Let's take a look at taping for gluteal activation. First of all, the glutes are made up of 3 muscles: Gluteus maximus, medius, and minimus. In terms of attachments, the Gluteus maximus originates on the coccyx, edge of the sacrum, and the posterior iliac crest. So lots of attachments, lots of directions. And those fibers insert down into the gluteal tuberosity and the iliotibial tract on the femur. So in terms of actions, its main action is to extend the leg, extend the hip. And also it laterally rotates and abducts the hip. And some of the lower fibers actually adduct the hip. So multifaceted, multi-actioned muscle. So why might we activate the glutes? Well, there's a number of reasons. Sometimes this is an area of muscle that may not fire in the order we like it to. Maybe it doesn't work quite as hard as we would like it to. Or maybe it's just not supporting our client's movement in the way we would like it to. So if that's part of our treatment plan, part of our goal, then we might use the tape to help stimulate proprioception and motor control in that area. The tape will simply provide a stimulus to that area, which is really, really useful if we're doing movement reprogramming. But as always, it depends on your client, your treatment, and your plan and what your goals are together. So in terms of taping, we're going to do a 1-step taping to simply activate and stimulate the glute max. Other options, so different pieces of tape. I'm going to use a 10 centimeter piece of tape because it's such a large muscle group. I will just get more coverage and more stimulus because I'm touching more skin. But you could use 2 pieces of 5 centimeter tape or even just 1 piece of 5 centimeter tape. I would say try what you have and see what result you get and determine whether or not you need more coverage. You might activate both sides if this is an issue that's bilateral for your client. Whereas if it's more rotational or where we have one glute or one side of the body that's maybe not moving in the way we'd like and we want to stimulate one side, then we might just apply it to that one side. So as always, it comes back to your treatment plan and goal. So it's an activation, so we are going to anchor towards the midline of the body. So we tear back that first inch or 2 of tape and we're going to anchor that on the back of the pelvis. Now it's an activation, so we need just a light stretch on the leg and a light stretch on the tape. So bring that hip into flexion, light tension on the tape and lay it down across the glutes. Relax the leg and anchor with no tension, rubbing well to stick. Simple and effective.